future of the COVID-19 vaccine is a bit unclear following a new push from the Health and Human Services Secretary. Last week, Kennedy said he wants to remove the CDC's recommendation for children and healthy pregnant women to get vaccinated for COVID. He made this announcement without a complete deliberation from the Advisory Committee on Immunization Practices. That panel had been expected to vote on the issue at a routinely scheduled meeting here in June. Uncertainty about the new recommendations now extends to health professionals here. WFMY News 2's Giselle Thomas talked with a Triad physician about what she's advising patients in this interim period. Giselle?
Yes, now here at the Guilford County Department of Health and Human Services, a spokesperson tells me that it's waiting from guidance from the state for its COVID-19 2026 recommendations. And it's an echo that's similar for doctors all throughout our state. Now here's what we know right now. The FDA is moving forward to approve the COVID-19 updates for seniors 65 and older and others that are at high risk for the disease. Now, the FDA says that it will also require vaccine makers to do more clinical trials for wider use. Now, I asked Dr. Carla Robinson, who's a medical editor at GoodRx, which tells me that that high risk is limited to people with chronic conditions and weakened immune systems. She also says that it's a waiting game for what could happen to the COVID-19 vaccine and its use in healthy adults who want a booster shot. She also says it's also unclear on how the new guidelines will affect insurance coverage.
Good news is, as of now, you can still get your vaccine at local pharmacies. And so we certainly recommend anyone who is concerned about some of these changes that are happening and what this may mean for their access to the vaccine. We certainly recommend people to go ahead and get that vaccine now. Regardless of, which category you may or may not fall into.
Now here at the Guilford County Department of Health and Human Services, it says that it's hoping to get those guidelines from the state by the summer. And Dr. Robinson tells me that according to trends from previous years, it looks like COVID should be peaking or starting to kick up around once we get into fall. Live in Greensboro, Giselle Thomas, WFMY News 2.